Hello there, I'm Dean Curry, President and founder of Massage Terrific. We are an in-home massage service right here in New York City. We have been posting daily updates on different types of massage because, a lot of times people want to try a new, specificity in massage, if you will, and they're not quite sure how to go about it, or where do I go for massage? And when you start bringing up more technical terms, for example, or for not an example, more generally speaking, when you talk about deep tissue Swedish massage, a lot of individuals know what that is. For the most part, people may have heard of reflexology, to be explained as done on the hands and the feet only. But when you start getting into terms like what is cranial sacral massage, people, it's an intense word, cranial sacral. Not to people in the industry or have been trained in the industry, but for more of the novice that understands or have heard or maybe are just hearing about cranial sacral therapy, and it sounds like a very technical term, but it really isn't. Cranial meaning the head, the crane, the cranial area, and sacral meaning the sacrum. So it's basically a massage that focuses, I shouldn't say it focuses primarily on the upper region near the sacrum and the cranial area of the head, because cranial sacral is something that extends all throughout the body, and there are certain hold positions, traction positions that you do during the massage, even on the feet, where you're doing traction on the feet or shoulders. There's slight traction, and when I say traction explained, and I feel the need to explain a lot of these things in technical terms, because again, for people in the industry, this is almost as easy as breathing, these technical terms. But for people that are more of a novice, that don't understand cranial sacral therapy, I always feel the need to explain even some of the more relative terms or general terms that we therapists know on a much deeper level. And traction is basically when you are pulling apart or trying to create distance in an area. So for example, if you were doing some traction on the feet, you would be pulling the feet. If someone's lying on their back and I have their feet right here and they're lying on their back, I would basically be pulling the feet towards me to create some space in the joints of the leg and lower back in order to create some form of attraction or separation. And that separation is vitally important if perhaps you have some form of compression in the spine, or if you have certain areas of sciatica, which could be a pinched piriformis muscle. Those who don't know where the piriformis muscle, it's basically on the gluteus maximus, or the butt region, and it extends from the side of the hip, the greater trochanter, which is your ball and socket, to the sacrum. And it's not very big, it's about as big as my index finger, a little thicker than that. And it supports the hip in that area. And a lot of times when people get sciatica, for example, they naturally think sciatica is caused by the back, which it can be, certainly in the, L4, 5, S1, and 2, which are the lower parts of the vertebrae. You can have some compression there, pardon me, and that could cause sciatica. But very often, or in more cases than not, sciatica is caused by a compression in the piriformis muscle, which is the side of the hip and side of the gluteus maximus. And it has a name called like piriformis syndrome, and that's just basically a pinching or an obstruction in the piriformis muscle, which is creating a lack of flow or circulation in the leg, and that's how you get sciatica. However, so traction in those type of areas in craniosacral therapy, a lot of times before a session with clients, we may provide some form of traction where we're extending the tops of the feet if someone's lying on their back, and sliding back slightly with a slight pull to create some form of space. We may also do those type of things in the shoulders as well, pushing down in the shoulders from the top of the massage table to create some separation in the muscles of the trapezius, which go from the occipital point to the side of the shoulder. The occipital point is the back of the head of the skull bone. And it's a long muscle, and pushing down on both shoulders creates a little space there. And a lot of these traction type moves in a craniosacral session may be something that we start our sessions with, as well as measuring the rhythm or blood flow of a fluid called cerebral spinal fluid. I'll say it again, cerebral spinal fluid. It is basically the fluid that circulates the lobes around the cranial region, whether it's the frontal lobe, which is the front part of the head, the parietal lobe, which is the top part of the head, or the temporal lobes, which are near the temple and the side, and so on. And the cerebral spinal fluid circulates all throughout the sutures in the cranial region of the head, and extend down the neck spinal cord, the spinal cord in the neck, and all the way down the vertebrae of the back, the thoracic region and the diaphragm, all the way down to the lower diaphragm, and then to the back of the sacrum, which is on the back of the vertebrae near the gluteus maximus and the tailbone of the back. And this cerebral spinal fluid has a wave of fluid in circulation. Some call it a rhythm or a biorhythm. And what this does is it circulates around the back, down around the sacrum, up the other side of the vertebrae, down the vertebrae, up the other side of the vertebrae, and through the cranial region of the head, and around all the sutures of the temporal lobes, parietal lobes, frontal lobes, all throughout the cranial region. And it's a flow that circulates several times a minute. And certain things in cranial sacral therapy, and I'm trying to keep these explanations rather simple, this rhythm of flow creates a homogeneous state. Now, the word for homogeneous state is a balanced state, or simply put, a functioning state throughout the body. You want to have proper function and flow of the cerebral spinal fluid, which circulates around the vertebrae, sacrum, and the spinal cord and the sutures throughout the cranial region of the head, because it is that system or wave of circulation that basically transports itself through the nervous system of the body and creates the flow that is needed for a balanced state or a functioning state. Now, there are certain things that disrupt this rhythm that circulates several times, let's say throughout a minute, depending on the person and their anatomical system. And certain things could create tension, stress in someone's life. Maybe someone's overworked, or they're not sleeping well, or they have some conditional mechanisms going on in their body, whether it may be a condition as far as their physical health is going on, which could be a myriad of conditions from chronic, head migraines to just as disrupting the system as a whole. Maybe you're overworked, maybe you have a very physical job, and there are fibrous tissue, spasms, knots, whatever you want to call them, trying to use terms that are more familiar with people. And these type of disruptions, whether they be physical, whether they be emotional, maybe you just have a lot of stress, anxiety, or post-traumatic stress from something earlier in life, or depression, or sadness, or whatever the case may be. A lot of these conditions, cranial sacral is used. There were several studies done in 2008 and 10 by the Integrative Cancer Society that studied people with cancer that were receiving relative, treatments and, regular treatments for cancer. And then there were people that were receiving those same, treatments. And the people that were receiving those treatments, the one group, and then there was another group receiving the same treatments, but they were also getting cranial sacral massage, which helps you to relax, which restores the flow or the wave of cerebral spinal fluid throughout the body, settling your nervous system and allowing your entire body to function correctly, causing a balanced state, causing a functioning state, calling what we would call a homogeneous state, which is what you want. Mr. Upledger, who was one of the founders of cranial sacral therapy and the school and philosophy of it, although it dates back probably to influences way before that could be of Asian history as well, not directly but indirectly. A lot of these type of theories that we come up with in modalities and massage actually stem off previous theories dating back to whether it be India or China or Japan or varied of places that got extended. Mr. Upledger created a really developed cranial sacral therapy, and basically, in cranial sacral therapy, to get to the gist of how it is performed, anyone could do it. If you're a first-time user or a second-time user, it's done with your clothes on, essentially. And you can a lot of the hold positions are stagnant, and what I mean by that is they're hold positions. You do it with your clothes on, laying on your back, let's say, and a therapist can measure the rhythm of your cerebral spinal fluid and rebalance it. And those are done by a synergistic hold, let's say, of the sacrum. If someone's lying in the back, you sneak your hand in there underneath, right on the sacrum, and you could rest your hand on the diaphragm, having a synergistic feel. And what I say by that is you have something on the bottom and on the top, creating a yin and yang or synergistic hold. And basically what that does, more or less, the therapist really isn't doing much there. They're not really pushing or pulling or anything like that. They are basically analyzing and feeling the rhythm of your cerebral spinal fluid, and we can actually tell if it's disrupted. And what was discovered scientifically is there is a shift in many of the movements and bones in the body. And what that hold position does, which we could hold essentially for maybe 3 or 5 or even more minutes, we will basically shift our hands, not in a direct way where we're controlling what's happening, but we're actually shifting based on your body. And that shifting that occurs and our hands moving east, north, west, or south, or anywhere in between, the shifting is actually being occurred by your body, and we are shifting with it, and it is through that touch and reshifting through our hands, and it's a very stagnant position. We will find your rhythm again, and our hands will shift and become in line with the unison of your naturally moving wave of cerebral spinal fluid. Now that could actually be done on the upper diaphragm or upper chest as well, where a therapist in cranial sacral therapy can feel the rhythm of the cerebral spinal fluid, perhaps laying their hand on the chest and on the neck, the bottom part of the neck. And you're not pushing, you're not sinking, it is very light touch, but you will notice a shift that is done. I personally very often like to lead with moving from the lower end of the body, perhaps with some traction on the feet, moving up to the shoulders in traction, and a couple of other traction moves that you can do in a separation of the joints in cranial sacral therapy. And then I move through the diaphragm and I move up towards the head, only because we live in a gravitational world, and for me it makes always more sense to work from the base of gravity, your feet, and work up towards the head. However, it could be done from the head down, or whatever a therapist prefers. So then moving from the traction inside the shoulders, we usually will have all these hold positions and rebalance and shifting going on. And Mr. Upledger is also on record as studying scientifically that and he isn't the only one, he's building on philosophies dating back from thousands of years, that the regions inside the head, whether it's the parietal region or the frontal lobe, which is the front of the head, the parietal region, which extends from the top of the head down, and then the occipital ridge or the occipital region, which is the back of the head, there is actually sutures explained more easily. There are basically a separation of each region inside the head, whether it be the parietal or the occipital or the frontal lobe, and there is a suture like almost sewn together. There's a slight separation between these, and it's been discovered scientifically or talked about that there is some form of movement or shifting within those regions in the lobes of the cranial region, which the cerebral spinal fluid moves through and is disrupted, again, by anxiety, depression, or physical stress, emotional stress, or spiritual stress, whatever it may be. It is important to end this cranial sacral. In my case, I like to end with the head. Perhaps you are lying on your back and we are holding the back of the head with one hand cupped underneath the occipital area of the back of the head, and you're lying on your back and your hand is resting into our hand, and we aren't really pulling back, but we are just applying a slight bit of pressure. That would be the slightest bit of pressure with traction, meaning pulling back, but we're not pulling back. It's something that falls short of pulling back. It's almost just like the slightest pressure, and it is your relaxing and your anatomical structure and movement within that hold that actually causes a shift, and you'll feel it. You'll feel it with your eyes closed. The therapist will feel it. It almost feels as if times that the neck is actually stretching and elongating, a half an inch or a quarter of an inch. But it's not quite that, and it doesn't have to be a pull straight back. It could be another form of a shift. So one hand might go under the back of the head cupped while lying on your back, and the other, would come, forward to the front of the head, sort of like this, or even better, the thumb and the pinky finger, and you will be coming right underneath the temporal region, okay? right in here, right above the temporal region. And again, you're not pulling back, but you are basically guiding back, and it is separating, or I shouldn't say separating, because you're basically lifting slightly, but it's ever so slight that I don't even like to use the word lifting. It's just a guide back between the sutures of the cranial region in between the different types of lobes you have in there. And the shift happens. You'll feel it in a hold. You could hold it for a couple of minutes or longer, and you'll feel an actual shift. And there are many holds on the head in cranial, or several in cranial sacral therapy. There's another one where you snake in, between the ears and the head and the parietal, the frontal lobe region, where you're coming in through here and you're kind of pulling back on the forehead and the parietal region with the finger pointing and the middle finger and the index finger, and you're kind of pulling back. And on the bottom, you're snaking in between the back of the occipital region with these two fingers, your ring finger and pinky finger, and you're basically kind of separating the back through the occipital region, which is the back of the head. And you're basically going in between the sutures, and you're waiting for a shift to happen there. And these are a few of the many a handful or so techniques used in cranial sacral therapy. And when your eyes are closed, and I've had cranial sacral therapy done on me many times, and I've actually felt the shift. You feel it. I mean, you feel it when it's being done to you. And as a therapist doing it, I feel it. And sometimes I talk to the client after, and we discuss, what they felt during it. I don't always ask them, like, did you feel the shift or anything like that? It's not what a therapist does, because that puts pressure on a person to answer in congruence, to what you're asking. And you never want to ask it that way as a therapist. You just want to ask, how did the session go? Did it feel okay? Those sort of things. Is there anything you want to discuss or anything like that? Open-ended questions, just to get your client perhaps discussing it if they want to. And then as they start to elaborate, then you could go into, perhaps they were saying, when you were doing that specific hold in the cranial region, I actually felt the separation. You never want to volunteer that information as a therapist, because again, you're putting pressure on your client to answer the way you want them to answer. And that's not what cranial sacral therapy does. Cranial sacral therapy is, a relationship between two spirits, emotionally, physically, and spiritually, and there is such a connection, unlike a physical massage, deep tissue Swedish massage, such a connection between two people accepting each other in a session, and there has to be complete and utter relaxation and calmness for it to occur. And it has, 50% of it's being done by your client relaxing, and 50% of it is done through your therapist. And you want to answer questions and ask provoking questions to get them to start talking about, oh yeah, when you had that position on my head, I felt a certain type of movement occurring. And then that's when a therapist kind of explains that, there are sutures in the head, and there's movement in the head, and these type of positions, I'm placing my fingers in between the sutures of the regions or lobes of the cranial region, and they're specifically designed to cause a form of traction, if you will, for lack of a better word, that creates space in between those areas so the cerebral spinal fluid can run, nice and fluid, through there without interruption. And sometimes you just have to create a little bit of space, for it to kind of run, makes sense. You create a little space, and then all of a sudden there's more space for the fluid to run through. And then all of a sudden it relaxes the body. It helps with depression. It helps with anxiety. It helps with, symptoms, as I mentioned before, symptoms that occur through integrative cancer research, where there's a lot of stress involved with cancer treatment, of course, and there's a lot of anxiety involved with that, and it's used for that, calming down the body. Any back discomfort, neck discomfort, even lower back sciatica. It has a way of stimulating the body through, the nervous system being reignited to go throughout your body in a balanced state, and that's where the homogeneous states come in, or the balanced state or the functioning state comes in, because then at that point your body is operating the way that it should. And the reason why cranial sacral therapy is such an effective therapy, and one of my favorites, is everything stems off the vertebrae or the spinal cord. It's where we were born off of, and everything stems off that core, vertebrae, spinal column, in the neck, and all the nerves, come off there, and everything spreads out through the body off the vertebrae and spinal column, your core. And that's why what's so great about cranial sacral therapy, it is a therapy that focuses primarily all areas of the body, but primarily its direct function is to deal with the vertebrae and spinal cord and sacrum directly. It is a therapy that deals with it directly, and it moves out from there. And it branches out from the area, which is where everything basically stems off of. So it's an incredible, and like I said, I've had it done to me, thousands of times. I've had cranial sacral therapy done on me. I know what it does for me. I know what it does for my clients. I've heard testimony after testimony after testimony. I've even done cranial sacral therapy on a client that had an accident in her C3, C4 region of her neck, and she couldn't move her neck. She walked around as if she had a brace on her neck, like when you get in an accident, you have to wear a neck brace. She basically walked around like that, very stiff neck, and it was noticeable. She had to turn her body left and turn her body right in order for her to see something, because she couldn't turn her head left or right. Now, I did a crane just to show you that the variety of cranial sacral therapy, and I was talking about things like depression and anxiety and migraines and backaches, but the variety extends a lot further than that in cranial sacral therapy, because I had actually performed cranial sacral therapy along with Swedish massage, and a lot of my massages I encapsulate a lot of different modalities in one session. And a lot of times it's not just Swedish, it's going to be Swedish reflexology, some Thai, maybe some shiatsu, some polarity, some cranial sacral therapy. I just kind of, depending on the client and what they need, I use whatever modality I was trained in, and I do. But anyway, she was in a car accident, and she would come to the session. She couldn't move her head left or right without it hurting, and she came in, looked very stiff. When she came in, I was like, "How's the neck?" And she's like, "Can't really move it around, just straight." And at the end of the session, and we did a whole bunch of different Swedish, this reflexology, whatever the case may be. But I always ended the session with her on her back, and we did the cranial sacral hold, the certain areas of the head, which I mentioned, where we're pulling back in the parietal regions, and then we always end with I call it the cradle hold, because you're cradling the head with the thumb and pinky finger around the parietal region and frontal lobe at the front of the head, and the one hand is cupped underneath the head with your fingertips surrounding the occipital region. And again, you're not pulling back, but you're providing tension. So you're sort of leaning or guiding, I like to say, guiding tension that's back, but you're not pulling. And I would hold that position on her, and as I would hold it on her for the first minute, not so much happened. It's more of a analyzing, where I'm trying to analyze what I'm feeling. And then after about 2 minutes, I felt a shift, and it was usually It could be a shift in many directions, but it was usually a shift with her, with this one patient, was a shift back, and it felt like an eighth of an inch shift, or I should say a 16th of an inch, probably more like a 16th of an inch. And then I would hold that position further again, and then after about another 30 or 45 seconds, that there would be another shift of maybe a quarter of an inch. And it created that space. It created the flow now of cerebral spinal fluid, which was being blocked, and now with that space it was operating fully, and it just branched out through all the nerves of her back and spinal cord and head. It created a homogeneous state. And after the session, and this happened every single time I worked with her, after the session she literally got up and she was so happy, and she would say, "Look," and she would turn left and turn right and look up, you know, without moving her upper torso area. It was just her head moving around in a circle, and she's like, "I could move my head." And she was so excited. She's like, "I could move my head all around. How did you do that?" And you know, she didn't have a lot of cranial sacral work done. And a lot of people think cranial sacral work is done for depression and anxiety, and it is, but it also can create, you know, something with traction that a person who can't even move their head or neck. And she said it would last her the rest of the day, and then of course the stiffness would come back, and we would, you know, work again a couple of days later. But to have that type of freedom and movement, and you know, the more I worked with her in cranial sacral therapy, the more she was having elongated times throughout the day, sometimes lasting more than 24 hours, almost to the time I would see her almost 48 hours later, where she would have movement in that neck before it stiffened up. And so, you know, it's an incredible, you know, modality for massage. I mean, it's called craniosacral therapy, but I also like to say it's a form of massage, because that's something that people understand. They don't understand craniosacral therapy unless they have knowledge of it. And I have to a lot of times say, "Oh, it's like a form of massage." And they go, "Oh, okay." So a lot of times I say it that way, but it's really craniosacral therapy. But certainly, you know, by all means, I am actually going to be doing some videos on it coming up. I've been introducing a lot of the videos from Talking Points, but I'll be doing some of these videos coming up where we actually get some footage on tape of me doing it in a session. And certainly follow us on Twitter, which is, you know, because I have daily updates on massage benefits all the time. I'm always talking about benefits, and, you know, I post a lot of my own information, but I actually post a lot of other people's scientific information on our Twitter page. So definitely tune in on Twitter. It's under our company name, Massage Terrific. So, you know, www.twitter.com/Massage Terrific. And you can post questions there or ask me questions. And our YouTube channel is under Massage Terrific as well. And I just want to thank you all for joining in. And we will be updating this pretty daily. And thank you for tuning in to our cranial sacral explained benefits for therapy. And I hope that it's been very helpful. Have yourselves a wonderful day.